Okay, so hi everyone, and welcome to the monthly public talk series of IEEE Women in Engineering Affinity Group, Albuquerque section. And I'm Aisha. I'm the chair of the IEEE Women in Engineering Affinity Group, Albuquerque section. Today, Dr. Losada-Rojas, assistant professor at the Civil Construction and Environmental Engineering at the University of New Mexico, is joining us as our keynote speaker. Before joining the University of New Mexico, she was a postdoctoral fellow at Mobility Network at the University of Toronto. She obtained her Ph.D. from Purdue University in May 2022. Dr. Losada-Rojas' work aims to develop and advance transportation solutions that positively impact community health through behavioral changes. And currently, she is also the Assistant Director of the Center for Pedestrian and Bicyclist Safety, which is in short a CPBS, which is a Tier 1 University Transportation Center. And also, Dr. Losada-Rojas has been awarded various recognitions, such as being named a 2021 MIT Rising Star. That's an amazing and inspiring bio. Thank you so much, Dr. Losada-Rojas, for making some time to join us and share your journey. For today, unfortunately, our group advisor, Dr. Tsiropolu, cannot join us as she's traveling, but with us, we also have our vice chair, Ariana Santamaria Peñafiel. And without taking any time, I would like to directly give the stage to Dr. Losada-Rojas.
Thank you, Aisha, and thank you so much for the invitation. I was invited to do this last year, but I was like so full of presentations and meetings, but I didn't want it to miss the opportunity to share what I have been doing with all of you. So I just wanted to make sure that you all see now my screen. Can you just give me a thumbs up?
Yes, we can see this.
Okay, perfect. So as Aisha mentioned, I am an assistant professor at the University of New Mexico, and my talk will be about healthcare or making healthier communities through transportation strategies. But before I start that, I wanted to also have show you a little bit from where I come from. So I am originally from Colombia, and I was born and raised in a rural area in Colombia. That name is Florencia, and then I moved to the biggest city to pursue my bachelor's in civil engineering. And after that, I found a passion for transportation, and I moved to do my master's and PhD at Purdue University. I was there until 2022. And then I moved to the University of Toronto to be a postdoctoral fellow under a person that I always admire and wanted to work with. But as life moves on, I then wanted the academic position, and I was chosen by UNM to be an assistant professor in the civil engineering department, and has been one of the greatest experience of my life. So I have also experience working with diverse collaborators, not only in academia, but also in departments of transportations around the US, also with the City of Toronto, specifically the Strategic Policy and Innovation Office. But also I have had different partners throughout the years with whom I have been working to make every thing that I'm going to show possible. So some of them I wanted to acknowledge them here. So let me start by just clarifying or just bringing this broader picture of why transportation and public health, which is the aim of this talk. So we know that transportation plays a critical role in public health for several reasons. The first main thing is connectivity. So how we reach healthy food, for example, it's mainly related to transportation. There is also the component of air pollution. Right now, we are evolving to try to do more sustainable vehicles that could achieve less greenhouse emissions so that we can minimize that air pollution. We also have an influence on physical activity. So how much you move for transportation purposes could also be a factor that's affecting your physical activity and could have implications for other non-communicable diseases that you could suffer. Another thing is noise. We see that through research, we have become, or it's becoming a trend that noise, it's mainly prominent when there is a disadvantaged population, and how we have planned transportation has mainly shaped that happens. And then the last thing, but not least important, is safety. So safety and vehicle or road crashes are actually one of the leading causes of deaths globally. So we are through this relationship between transportation and health, trying to tackle safety problems as well. So I wanted to just show some statistics to put you all in context. So 40% of public health depends on economic factors like education and employment, and you need transportation to get to those. We also know that 10.5 of US households face food insecurity in 2020. And mostly when people is asked why, they mention that transportation is a remarkable barrier, especially if we are talking about very dispersed and large areas, such as rural areas. We also know that 20.4% of road fatalities are pedestrians and bicyclists in the US. And these two modes or these two actors of the road are actually the most vulnerable of the roads. So if you crash in a car, your likelihood to die it's smaller than if you are crashed by a car while you are being a pedestrian or a bicyclist in our roads. Then we also know that 29% of total US greenhouse gas emissions are related to transportation. And as I mentioned, we're trying to tackle that through different strategies. We also know that 42% of US obesity prevalence, that's the high rate of obesity prevalence as average in the US. And we know that through active travel and public transit, we can help to minimize that and to solve that. And then we also know that roughly 34.5% of the total deaths in the United States can be prevented or minimized with enhancing transportation solutions throughout our communities. So because of all those statistics, my research has mainly focused on understanding how past, present, and future transportation capacity to strengthen community health could be done through what we design or how we design and plan transportation solutions. So now I wanted to just make a quick pause and ask Aisha if you would like to see or to share with me which case study you would like to see first. So we have past, present, and future as case study. And I'd love to start with what the public prefers. Okay.
So yeah,
we can go with present, or we have half of them present, and then we could cover the other two. We will get to see all of them, but I just wanted to check in which one you guys wanted to start. Okay, so let's go by present. And as present, I'm showcasing a study that's published in the Journal of Transportation and Health, and I have left the link below. But this study was titled Access to Healthy Food in Urban and Rural Areas, an empirical study. So we mainly have two goals and two objectives for this study. First one was to identify the differences between healthy food accessibility. So how easy it is for you to reach healthy food in urban and rural areas that we are considering have different transportation modes available. And then the second objective was actually to explore the relationships between those healthy food accessibility measures that we calculated and the characteristics that surround a person. So if you are, for example, in an urban area, you are more likely to have a store nearby than if you are in a rural area. So we wanted to really understand what are the drivers of having better food accessibility around you. So for that, we use a two-part methodology. So the first one was calculating a cost-based accessibility measure. And how we did that, we use ArcGIS mainly and some R to calculate how much expensive was to reach healthy food in a function of time, the hourly wage that you have, and also some of the fixed maintenance and fee cost of using the different transportation modes that we were studying. Then the next thing that we did was we used spatial econometrics modeling, more specifically spatial autoregressive models with autoregressive error structures. So what these models do is pretty much they are trying to account how much of your cost to access healthy food is actually influenced by your neighbors. So if you are in a specific census block group, how much of what you are facing as cost to access healthy food is also dependent on what's located or what are the characteristics of your neighbor census blocks. So once we have done those two methodology, or once we have decided that methodology, we defined our case studies and we used data from 4 different systems in Indiana. So the systems were diverse in the sense that they had different transportation or public transportation systems that were serving them. Some of them, like Marion County, where Indianapolis, for example, is located, and they have a large fixed route, which will resemble what like Albuquerque has right now. And then we have some other case studies that will increase the level of flexibility of those specific public transportation modes. We also complemented that with secondary data. So we got information about where supermarkets or healthy food providers were located, and we geocoded those information into our area of study. We also used built environment variables, and we used the transit routes and stops from the different agencies that were our case study. We also used the transit fare information to try to account for that fixed cost that getting into a bus means for these different areas. So we had different results. So first thing that I want to show are the results in terms of travel cost by mode. So we saw through this paper or through this study that Marion, which was the most urban county, which was not surprising, had actually the lowest cost to access to healthy food. And then, of course, the part that was more rural in our area of study was suffering the highest cost of reaching healthy food. So if you can notice here, for those who were walking, we can see that there is like accessing to healthy food on average might cost a person 53.91%. And this is accounting for the time that they have to spend reaching out the provider or the supermarket. We also noticed through our methodology that cost is not randomly distributed. That means that if we have pockets of places in the areas of study that face higher costs and they were clustered together, we also saw that areas with healthy food providers were clustered around low cost, and that makes total sense. If you are closer to a supermarket, then it will be easier for you to reach the food. And we also noticed that areas in downtown were clustered around low cost of access to food. Through the spatial models, we also identify some key variables. So we saw things like medium intensive development, so how much development there is in your surrounding might affect your cost to access to healthy food. We also saw on the design of the infrastructure, we saw that, for example, auto-oriented network or the provision of roads that are mainly auto-oriented have also an impact on how much healthy food you can reach. The diversity, so how much residential density are surrounding you, also have an impact. But we also saw some social demographics as significant of those models. So for instance, percentage of population over 65 years old showed to be significant, and also people who had 0 vehicles available in their household were facing the highest values for access to healthy food. So in conclusion, for this specific one, we use current travel modes to explore the differences between healthy food accessibility in rural and urban areas. We found that, or we suggest that a fair distribution of the resources across space, especially in those rural areas that we saw face the higher prices might lower the cost of reaching healthy food. Then we also provided some alternatives in terms of the transportation to try to bring closer healthy food to population that cannot access it. So for example, we talked in that paper a solution for instance, pop-up farmer markets or drone deliveries to food to this specific population might help. So with that, I'm going to close the present, and I don't know if we had someone else choosing any other terms, but if not, then I'll go to the past.
So I had a quick question.
Yes, go ahead.
You showed it. You showed a study between different counties. Some of them were rural, like too rural. Some of
Yes.
them were more developed. So have you ever do you in any of your past, present, or future research had one where you had a country-based, meaning it could be developing, developed, or underdeveloped, and to see how it was different?
Actually, no, that would be very interesting. So I was through the studies that I am going to show, most of the cases are in the Midwest of the US because that's where I was based doing my PhD pretty much. But I think it would be very interesting to see how that variability is if we compare countries.
Yeah.
Or even if we compare states.
Yeah, the reason why I'm asking is I think even if it's developing or even if it's developed, they will all have cities, not necessarily to be rural, because rural means there might not be transportation. But in
Yes.
developing or underdeveloped, there will be transportation, but how different is it and how difficult is it to reach healthy food, right?
Yeah, no, I love this idea. I haven't touched base on working like across countries, but I think it's a very valid point, and we will probably see that there are different things that are making an influence on that cost that I calculated through that matrix. And I guess like the methodology could be applicable if the data is available. So
Awesome.
I
This
think
is
that's a
actually
great
very
point.
interesting.
Yeah. Are there any other questions?
If
Then
anyone would like to ask, you can also use the chat for any questions. Else we can continue.
okay, perfect. So let's go to the past. And in the past, I actually looked at a different problem. So this one is economic resilience and recovery in the Great Lakes region, socioeconomic and transportation infrastructure perspective. I also have a paper on this one, and I am working on my second one that's under review. But the goals for this specific project or study were to uncover the significant social demographics, but also the infrastructure that has an influence in making communities more robust. So if there is a shock, like for example, COVID, right? How our transportation infrastructure could be used to make the community more resilient to this shock. So I just want to acknowledge here some of the partners that I have for that project. So again, for this one, I use a two-part methodology. So the first one is actually coming more from the social sciences, and it's called the community capital framework. So in this community capital framework, we have 7 different capitals that in theory could boost a region, right? So it's the human capital, the social capital, build capital, and so forth. We combine that with statistical modeling, more specifically structural economic concepts and structural equation models, to try to identify from the region that we were looking at what are those variables that are representing those capitals and how they are interacting to make a region more robust and more resilient. So again, I used some case studies in Indiana. This paper was actually part of it qualitative, so we had to run some interviews, and we did that in 12 different counties that included urban and rural counties. But we also use some secondary data to calculate or to run more of the structural equation model that's more like a statistical. So it was both that combination of qualitative data and quantitative data. So as the results, this one was like way more practical in the sense that we provided the community with an online dashboard where they could see their different strengths in terms of their communities, and also they could compare themselves against to the counties that were surrounding them and see how good or how maybe bad they were doing in some of those variables that we found significant. We also developed for them a what if tool to try strategies. So for example, one of the variables that I thought was very interesting that showed up as significant for this study was the percentage of female labor participation. So how many females work in your county actually make that county more resilient to shocks. So we wanted to see if I increase that number of or that percentage of labor participation, how much my overall resilience as a county is going to increase. So we created for them various strategies that they could change and see how much of that specific policy could affect their future economic resilience. So on this study, we used the past events, which was the economic shock of the Great Recession, to understand the role of transportation in building healthier communities for the future. We identified some variables, as you can see there in the map. Some were very interesting ones, and some were variables in which, there could be potential policy actions that could change the way that the community was being more resilient. We also identified those significant factors and created short and long-term strategies for these communities. And one of the things that I liked a lot from this project was that one of the variables that showed up as significant was what is called walkability index. So it's the potential of your area for people to walk, pretty much. And we found that investments in that specific infrastructure remain important to increase that resiliency. And it's just not only because they will allow you to reach places by walking, right? But we saw that that specific variable had also an impact on other things like your human capital or your social capital, which is how much connected a community is. So all of that, it's adding to that picture of making a community more resilient. And I think this is my closing slide for the past case. So does anyone has any questions before I move into the future? I'm going to take that as a no. And then I'm going to walk you through what we did for future. So for this study, we investigate the individual and the surrounding characteristics associated with autonomous vehicles adoption in Chicago. And we also wanted to see what were the implications of having autonomous vehicles deployed in the area in terms of the public health implications. And I see that is, oh yeah, Ariana, you have a question. How can communities effectively integrate active transportation, such as walking and cycling, into their urban plannings to promote healthier lifestyles? Okay, so right now, and I think there has been a boom of since like maybe 2010 on making mandatory a policy that's called complete streets. Okay, so in Albuquerque, it's actually mandatory since 2016. So every time that we are making some major improvement on our roads, then alongside that, they have to also make improvements on things like the sidewalks and the bicycle infrastructure as in the measure that's possible for the specific project. So I think like the US is moving more towards having those complete streets, which are mainly streets where everyone, regardless of age, race, disability, could walk through or pass through. But I think that change takes time. I don't think that's something that we will see from I don't know, a couple of years. I think there will be some years in which we will just start to see gradually those changes. But that's a way in which that has been tried or that has been integrated effectively in some communities. So Albuquerque has it mandatory. Uh, New Mexico, I am not sure, like as a state as a whole, but there are some good examples of cities that has become more walkable through the complete street procedures. For instance, last semester in my traffic class, we were looking at some very good samples, and in New Mexico, Las Cruces, downtown Las Cruces actually has a very walkable and an area that's considered a complete street. So there has been, or there are policies in place that are moving us toward that goal. But again, as I mentioned, it's something that just gradually transition to go that way. I don't know if that answers your question. I take that as a yes. Okay. So I'm going to move. I have something else in the chat. It does. Okay, perfect. So for this specific study that was the future, so we wanted to identify what characteristics of the surrounding of a person, also their social characteristics and the health context in which they live will be more likely for those who want to be early adopters of autonomous vehicles technology. So this project was actually sponsored by the Center for Connected and Automated Transportation. So again, it's kind of a two-part methodology study. In the first part, we use the market segmentation analysis, what is called the diffusion of innovation theory, that talks about 5 levels of innovation. So the first one, which are the innovators, are the ones who are most likely to adopt the technology first. So those are the ones that we are calling innovators here. And then the early adopters will follow shortly after the innovators have adopted. Then the early majority is kind of the center of the bell curve. Let's imagine that. So the early majority will come once the innovators and early adopters have already tested the technology enough so that they are confident that the technology is going to work. Then it comes the late majority, which are going to adopt actually later than those that are early majority. And then comes the laggards that are actually very reluctant to believe that the technology it's going to be something that they want to include in their everyday lives. So with that, we classify our respondents in those 5 categories, and then we use those categories in some GIS and statistical analysis. We use those adoption categories to try to find what were their characteristics in terms of their surroundings, their health context, and also their social demographics. So this data was actually collected in Chicago. We have some responses that were urban and some of them that were suburban. And we conducted a survey for that. And then we complemented the data with secondary data from different sources. So there is actually a very rich database that is the CDC 500 City Projects. That's also sometimes called Places. So they have a lot of data in terms of health outcomes specific to or at the level of census block, which is the smaller geographic unit that you could study something in the US. And then I also use US APA database and some other land use database to work around for this project. So the results, as I was mentioning, when thinking about this theory of innovation, we are pretty much talking about a bell curve. So in the 2.5%, we have those innovators. And we found that those that were innovators were most likely to be male. and also to live close to green areas. We found that those early adopters were young people, but one thing that we found is that those that are early adopters of the technology are also more likely to be in areas where there are high levels of obesity. So they can be like very car dependent, and maybe this is posing a challenge for the technology. We also found that the early majority value a lot the convenience of mode choice. So a car will also probably be something that they will be looking at to move themselves because it's very convenient. And then we found that those that are in the last category, the laggards, are those who really really value reliability on their services. So probably they won't use a service that might be shared because you don't know when that service is getting into your door. So we saw that the level of adoption is actually associated with a combination of social demographics, but also what is surrounding you. Like if you live closer to green areas, then you will more likely be adopting autonomous vehicles technology. So through this study, we explore the impact of future transportation innovations in society's active and healthy lifestyle. We through this study, one thing that we notice is that we should be cautious about how we are going to deploy AVs to ensure that they complement the existing urban development strategies, like what I was talking about, complete streets, so that they complement rather than compete with the policies and the strategies that we have already in place to try to move towards that greener and more active lifestyle. And then one other thing that we also mentioned in that paper is that programs that track the use of active travel could be used once autonomous vehicles are in place, and they could provide credit towards or discounts towards using autonomous vehicles for longer trips. So one of the fears that people often mention in the literature is that we won't longer have the need to walk or bike because that first and last mile of your travel will be done by an autonomous vehicle. If you will be able to be picked up at your door and then leave at the door that you need to go, probably you will be leaving behind those few minutes of walking that you are doing every day. When if you drive, for example, you park in a certain place, but that's usually not right in front of the door that you need. So you are gaining some walking time there that might be lost once we have autonomous vehicles in place. So through this paper, we just caution that there should be some policies that ensure that AVs complement the current strategies rather than creating more of a problem that could happen. So with that, I am finishing the case studies. So I don't know if anyone has any other question regarding this. Okay, one question. Yes, go ahead. Oh, that's a very good question. So actually for this last paper, we tried to assess or we tried to identify areas that were disadvantaged. So usually in transportation, there are certain groups, or mainly when we are talking about disadvantaged transportation populations, there are certain groups that you look at with, or that you give a closer look. So those are the ones that probably are not in the labor force, that are younger than 14, so maybe they cannot drive. Also, people who is older than 65 because they are not supposed to be driving as well. And also people who is low income or have a disability that makes their mobility harder. So when we have been including those variables for some of the problems that I have just shown, in some of them they show up as significant, in some they don't. But one thing that I know for sure is that we are facing unequal impacts from transportation. And I'm not showing that here, but I actually worked last semester with NMDOT data on a paper where I wanted to see if the additional cost that we are paying for our roads, it's equally distributed across New Mexico. So we found like very interesting things. For example, we found that if we use the federal metrics to assess how good a payment or how bad a payment is, if we use only those metrics, then we see that Los Alamos County, which is actually the county that has the highest average of income in New Mexico, has the poorest roads. But then when we add to those measures things like how much they could afford having these bad roads, then the picture changes completely. And then Los Alamos was like very well off compared to other counties that were in New Mexico. So to address your question, I don't think the inequalities are longer potential. I have seen them pop up in my research in different ways. I think there is not one size fits all solution for how we address inequalities. And I also think that since transportation is or relied so heavily on how much funding we have to do different projects or how the funding is allocated for where transit is going to go and so forth. I think it depends on and actually in the specific goals of a municipality or of a county or a state on how they need to go about solving them. I think like, yeah, I will say like there is not one size fits all, but I do think that I no longer believe they are potential. I am actually seeing them show in every research that I do. And not only inequalities in terms of low income, but things like race or gender disparities are also something that I often see when doing studies in transportation. But I don't think there is a unique or one answer way to go about it. One thing that I also can mention is that the Biden administration released a program that's called Justice 40, and they are trying to use their own measures of vulnerability of population, and now federal agencies are required to use those measures of vulnerability to plan for their expenses in terms of different things, but transportation is one of them. So there are things also that are being done regardless inequalities that people face in the different impacts of transportation. But those are just like the thoughts that I have in some of the initiatives that I have seen playing a role right now. I don't know if that addressed somewhat your question. I know it was not a very specific answer, but okay, sounds great. So now I'm going to move from the case studies to what my future holds here at UNM. So what is the future of all the things that I just showed? So I have like a vision for the group that I'm trying to put together here. I have been at UNM for 1 year so far. And then what I want to do with the group is try to advance transportation solutions that enhance community health. And how I'm trying to go about it is to understand those impacts of current and future transportation, understand what are the impacts that they will have on the built environment, and also on providing that equal access to different opportunities. And as the question that I just have, I am particularly interested in those opportunities for socioeconomic disadvantaged communities. And my main interest, I'm going to narrow it down, it's towards rural areas. So as you heard in the beginning of my presentation, I am from a rural area myself. So I wouldn't love anything more than seeing rural areas being, or rural residents being able to reach similar or attain similar health outcomes that those that are in urban places. So I'm trying to focus more of the research that I am doing in that specific disadvantaged community. But of course, as I mentioned through my research, I have seen many other of those characteristics that make a community disadvantaged pop up as well. So when I was also explaining at the beginning the different relationships between transportation and health, I showed things that were related to connectivity. You saw like access to healthy food in one of the case studies. I also saw something or show something about physical activity through that future case study, and how AVs are going to shape how much physical activity we might get. But now my focus of the research is also going towards safety. So accidents or unintentional injuries alone represent 6.5% of all causes of death in the US. Now, I don't know if you knew this, it doesn't make me proud to say, but Albuquerque is actually, or New Mexico is actually the #1 state for pedestrian fatalities in the US, and it has been for several years. We are also in the top 10 of cyclist fatalities. So this is a very local and present issue in our area. So UNM was actually selected last year to lead one of the 20 Tier 1 university transportation centers. And it was chosen from 168 proposals. And the director for the center is actually my colleague, Nicholas Frenchak, but we are working together to try to address this safety problem. Not only in New Mexico, but across the US, but we are at the center of the research that's happening right now, and it's a very exciting moment also for me. So I just divided, to give you an overview of the center, I divided it in the 3 questions that every project has to or should be asking themselves. So what is the center trying to achieve? Why is the center important? And how we will complete our work? So the first, it's what is the center trying to achieve? So through the center or through our research, we are trying to eliminate pedestrian and bicycle fatalities and serious injuries from our roads, and also improve the resilience of the transportation system as a whole to be able to advance sustainability and equity for all. And also tying that to what I talk about complete streets, I think that's the goal that we want to also pursue. And through our research, we are trying to find how is that we can get to that place where there are 0 deaths in our roads. Why is the center important? Well, I just mentioned that New Mexico has had the highest pedestrian fatality rate in the country for 6 years in a row. So it's pretty important for our state, but also throughout the US, pedestrians and bicyclist fatalities have increased in overwhelming numbers over the last decade. So this is not only a New Mexico problem, it's pretty much a US problem. So how we will complete our work? Right now, we have at least 21 projects that range from theoretical work to practical work that will be done in the next 5 years. We are just about to finish year 1. And then we are of course not working alone, because it would be impossible for just the 2 of us to tackle such a serious problem as this one is. So we are working with different universities to achieve those goals that I just mentioned. However, and these are my 2 last slides, we should not forget about those other factors in the relationship between transportation and health. Specifically here in New Mexico, we have 15.5% of New Mexico households that face food insecurity in 2020. So if you recall my first slides, the national average was about 11%. So we are above the national average also on that issue. We have 22.4% of prevalence of physical inactivity in New Mexico, and it's not higher than the national average, but it's not like that's a good comparison, right? We should try to get that down to single digits when possible. And then we also have a larger population that's classified as rural. And as I mentioned, that's the disadvantage characteristics that I am more interested to tackle. So through my research, I will be trying to promote sustainable transportation systems by identifying and creating tools that support planning for those systems and also executing them. I'm also interested on evaluating the social, economic, and public health impacts of new technologies. So I'm also trying to get involved in projects that might look at how electrification will play a role in the development of rural areas in New Mexico, or how other autonomous vehicle technologies like drone delivery could also play a role. And then lastly, but not least, most of the things that I have been working on and that I want to keep working on are those changes in travel behavior, because it's not enough to put something out there, but if nobody is using it as a constant or for the future, then it will be hard to actually see things like complete street being made a reality. So understanding those changes in travel behavior also play a key role on the research that I will be doing moving forward. I guess with that, that's everything that I had prepared for today. So if anyone has any questions, please feel free to put those on the chat or open your mic. And that's just my LinkedIn there and my email in case that you want to reach out to me with more questions after. Thank you so much.
Thank you so much. It's very upsetting to see that we're championing road fatalities here in New Mexico. So before we end, I'd like to ask a question. It's a general one just to end the session. So what advice would you give to those who want to, advocate healthier transportation strategies for healthier communities?
So I think and I believe this, and I actually do it. I practice this thing that I'm going to preach next. But I do feel like change starts by ourselves, right? So for example, you just heard me talking 45 minutes about how to use active travel, right? And it would be hypocrite from me to be taking my car every day to work. So I bike, and when I don't feel like, I take public transit. And even though in Albuquerque is not the safest way to do so, I still do it because it's the way that I believe we will go towards sustainability in the future. So I think starting by yourself is the most important step of reaching something at the end. But as I mentioned also, there has been a lot of political will lately, and there is a lot of funding towards things like safety and becoming more pedestrian and bicycle friendly in our city, that I feel that we have started that movement and it's likely to continue and not go away, I hope, for the next years. And I think that might be a way from which you can start to try to make yourself and your community more healthier through your own transportation choices and behaviors.
Thank you so much. So if no one has any other questions, I guess we could wrap it up for the night. Thank you so much again, Dr. Losada-Rojas. I hope I was pronouncing your name correctly.
Yes, perfect. Yeah.
It was very nice to meet you, and it was a very informative talk. And I hope to see you soon, anytime.
Yes, and please reach out, guys. If you have any questions, I'm always very happy to talk about my research or about college or about, going to the job market. Just anything, please let me know. I'm here also to support your education and your growth as professionals. So just let me know.
Thank you so much. And with that, we're going to end our meeting for today. Have a good night, everyone, and thank you once again.
Okay.